Dr. Vijay Bhaskar, Chairman, Ethics Committee, Clinical Research and Trials. So, the common disease in India is malaria. Malaria is infected with mosquito. Mosquito bite commonly leads to severe disease in the human body, where you will have symptoms like fever, muscle pains, joint pains sometime, and generalized malaise. The temperature goes from 100 to 104, 106, and then you will have an evening rise of temperature, where this Plasmodium vivax is the circulates in our body meantime in the evening. So it causes the chills and rigors in our body associated with the fever. So, malaria is the commonmost disease because of a lot of mosquitoes in Indian population or South Asian population, where this infection widely increases and then causes the disease. So, we have to confirm the virus, which is, I mean to say, the mosquito causing virus, through the peripheral smear of the blood. We see malarial parasite in peripheral smear of the blood, which confirms it, and apart from that we should see that the WBC count variability and the CRP and ESR levels to see the prognosis of the disease and the progress and recovery with the effect of the medicines. So, malaria and dengue almost the affected by even though mosquito. The dengue is hampers the bleeding or hampers the coagulation factors, leads to bleeding disorder and death, whereas malaria the person will affect the brain, where cerebral malaria is one of the most serious disorder which leads to cerebral edema and sometimes coma and death. So, malaria is not that easy taking disease, where we should confirm with the diagnosis, confirm with the clinical and signs and symptoms, and confirm with the blood test with an anti-malarial drugs like hydrochloroquine, which initially low mode of disease like temperature is 99 to 100, 101 with sufficient supportive medicines with the anti-malarial tablets. If not, then the disease is severe, then we can give an injectables like injection arsenate, so that the malarial parasite can be killed. So, this is the way in malaria and dengue, where malaria disease we need to take care that it should not transmit to the brain, where leads to cerebral malaria or brain disease, which are most dangerous, and then there is a possibility of death. So, such patients we should hydrate him, we should give sufficient oral fluids or parenteral fluids, and then we should give supportive measurements like if necessary admit in bed, and then give sufficient fluids with the supportive medicines like paracetamol, and then anti-malarial drugs, and then injectables if necessary, and then take the cerebrospinal fluid for the analysis of the cerebral malaria, and sometimes it may cause the hepatitis also. We must caution and we must observe it, and then according to there should not be any secondary bacterial infections. We should keep observing, and we should manage malaria to control it, and prevention is better than treatment. We should have our localities with the clean and green, and then there should not be stagnant water where there is a possibility of mosquito breeding, and then the municipalities and government should take care of fogging the areas to control the mosquitoes, and then the people should wear anti-mosquito repellents, and then they should have the full clothes on the skin, and then they should have the mosquito nets for the house to control the mosquitoes in the evening. So, this is the way we should manage, and then the management of the dengue.